Today on the Frontline Health podcast.
So we know that inflammation affects just about everything in our body. And if we can lower our inflammation, especially through our diet, we're going to be that much better off. Now, your point to the gut health, making sure that you've got good gut health and that you're checking on it. We know that the gut to brain connection is strong. And I don't think we ever in the medical world envisioned that the gut had that much of an impact on what our brain does, but it definitely does. And because of that, if you've got a poor gut health and you have a high inflammatory diet, we know that there is a greater risk of dementia. Well, thanks for joining us for this 5th season of Frontline Health by CenturionLabs.com. Super excited to have Evan along with me. Obviously, we're changing things up a little bit, hopefully to bring you guys more value and make this even more informative for each of our listeners. So, Evan, excited to have you. And we're going to kick off this 5th season with some health headline highlights. So why don't you get us started?
Yeah, excited to be here. On this first episode of Health Headlines, we're going to be talking about everything from tattoos and how that affects our health, to ADHD, to even dark chocolate. So a little bit of everything with these health headlines for our first episode of the 5th season. Before we dig into all of that, Troy, do you want to talk about just some changes we've had here with the company recently and kind of the direction that we're heading in?
Yeah, so we're super excited here at Centurion that we have acquired a new company called Number One Nutrition, and they are strictly a supplement company, and excited to have them on board because they have a presence on Amazon and have some great products that I think will complement the things that we have and allow us to really provide our customers and you guys with even better options and opportunities to really take ownership of your health. So super excited about that as we go forward.
I love it. Exciting things on the horizon for Centurion. And why don't we get started?
Awesome. So this first headline, our first 3 headlines actually for this month have to do with tattoos. And the first one I thought was interesting as we were running across headlines. It said 35% of tattoo inks researched include bacteria, suggesting health risks. And that's something that most of us don't think about. We're certainly in a tattoo culture now.
Mm-hmm.
And as we're starting to find out more about it, the interesting thing in this article, it said that 35% of tattoos and permanent makeup inks contain potentially harmful bacteria, which posed health risk for people. And that's in spite of the fact that those always come sealed, and they say that they're sterile,
Mm-hmm.
and they're still finding that within these inks that people are using at these tattoo parlors. So they're certainly starting to ramp up this warning, and I'm sure it's mostly because there are more people who are getting tattoos than we've had in kind of the history of the United States. And they even speak to some of those risks that are out there with tattoos, not just these allergic reactions that some of these inks can cause, but also the contaminated tools, and making sure that people are real aware that you want to go to a reputable place if you're going to get a tattoo.
So it's interesting that you say that we're kind of in a tattoo culture right now. I can attest to the fact that I have seen some sketchy tattoo situations. I've known of one friend who got a tattoo on an overseas mission trip to a third world country, and actually his arm got infected from where he got the tattoo. He did.
Wow.
And then another situation has to do with my time in the military, seeing a barracks tattoo.
Okay.
So everyone is not going to reputable tattoo parlors to get these tattoos. And I had always thought that the risk kind of came from the needle itself, but you're saying that it has to do with the ink, actually.
Yeah, so it's actually both. So anytime you put something in your body, you could have a reaction to it. And there are people who have allergic reactions to that. But now we're finding out that it's not just an allergy to the ink itself, but there's potentially bacteria in these bottles in 35% of those tattoo inks. So something that's pretty relevant, something you want to be aware of. And that next article that we have, the headline talks about an actual tattoo ink recalled due to high concentrations of microorganisms. So Sierra Stain is the name of the company, and they had several of their Bloodline branded tattoo inks have microbial contamination. So it kind of falls in line with what we just read with that other headline. So there was one that the FDA saw, they did some research on, and they pulled it because of the bacteria that it actually contains. So certainly something to watch for.
Interesting. I personally have made the choice to just avoid tattoos altogether. Do you have any ink, Troy?
I have no ink on
Okay.
me, but you know, you never know. Might put my mom's name on my shoulder or something like that someday. Who knows?
Nice. Yeah. All kind of opportunities there. Our final health headline related to tattoos says tattoos associated with increased lymphoma risk and size doesn't matter. Study. A study published in Lancet's eClinical Medicine suggests that tattoo ink contains toxic substances linked to a 21% increased risk of lymphoma, a type of cancer affecting the lymphatic system. So now that's a little more serious than just infections. We're talking about cancer.
Yeah, so that one certainly brought our attention when we saw that headline because you're right, bacteria is one thing and infection is one thing, and you can usually take some antibiotics to get over it. But when you're talking about lymphoma and the fact that it increases that risk, no matter how big or small that tattoo is, that actually adds another level of, hey, maybe I need to think about this a little bit more before I go off on a mission trip and say, hey, that's a great idea. Let's go get tattoos.
Yeah.
And let's just think a little bit more about it because I think our culture sees it as not really being a big deal.
Mm-hmm.
And, you know, tattoos in and of themselves, however you think of them, shouldn't really matter, but you should at least be aware of the risks that are associated with them and make sure that you're not you're not going cheap on your tattoo because bad things can happen when you go cheap on your tattoo. Go to a place that's clean, reputable, and certainly you've had other people who've gone there and haven't had any issues with them.
All right, moving on to our next health headline. College football game canceled over whooping cough case and exposure. The article discusses the cancellation of a college football game between South Dakota and Portland State due to a case of whooping cough on the Portland State team. Whooping cough caused by the Bordetella pertussis bacteria is highly contagious and affects the respiratory system. The CDC notes that the disease can lead to severe, long-lasting coughing fits, especially dangerous for infants and young children. So what I'm curious about here, Troy, is are we seeing sicknesses and viruses like whooping cough, I guess bacteria in this case, are we seeing these things increase again because of people not vaccinating their children as much or having a hesitancy to that? Does that tie into this?
I don't know that that really ties into it because we're seeing an increase not just in the U.S., but we're seeing it worldwide. So that may be part of it, but it may also be just the fact that our antibiotics are not as strong. We don't have the back in the day, I think people were more segregated, meaning you weren't flying country to country. You didn't have
Right.
people going from place to place. And now you're really having international travel all the time. And when you have international travel, those germs pass. So whooping cough was something that was pretty much non-existent in the U.S. until the last 5 to 10 years. So this was an interesting headline to see that they actually canceled a football game
Yeah.
because of whooping cough, which is something we don't really hear much of.
No.
So it'll be interesting to keep tabs on that to see what happens going forward. But that certainly caught our eye as we were looking at it.
So is this hysteria or a real thing to pay attention to?
It's probably a little bit of both. And the truth is, if we're healthy and we're taking ownership of our health and we're washing our hands and we're being good stewards with our hygiene, it shouldn't really be much of a problem. And if you have a cough and you're sick, stay home. Don't go out when you're sick, and hopefully it won't continue to be contagious because of those simple things. But our next headline, high dose of ADHD drugs linked to higher risks of psychosis and mania, based on a Harvard study. So there's a hospital called McLean Hospital that's affiliated with Harvard, where they found that high doses of ADHD medications like Adderall had significantly higher risk of psychosis and mania in their patients. So they had 5.3-fold increase in the risk of psychotic or manic episodes, and 81% of those cases they felt were preventable if they just lowered the dose. So again, this is something, and this month of October is actually ADHD Awareness Month. So it's something to think about as more and more kids, it seems, are getting diagnosed with ADHD. There are more adults diagnosed with ADHD. So don't just take the physician's word for it on the product that you're taking. Really pay attention to your symptoms, really pay attention to what's going on, because it can make a big, big difference. So the study actually concluded and said that ADHD itself, especially in individuals with a family history of psychiatric disorders, could increase the risk of developing psychiatric or mood disorders. So they said that it is a true link between amphetamine use and psychosis.
Mm-hmm.
So it's something certainly to be aware of as more and more people are diagnosed with ADHD.
This is really interesting to think about because, ADHD is one of those things we know there is a wide variety of factors that really play into it and impact it. So, with that, I'm wondering how much of this is medical, like how much of it is directly related to these high dose ADHD drugs, and how much of it is related to those environmental factors that we look at as well.
It's a great question because, to your point, there are so many factors that come into play. There have certainly been studies that show our diet is causing a lot of this ADHD. So we're not having a great diet for our kids. They're typically getting fast food or processed foods, and it's all been linked to ADHD. There are some studies that suggest some vaccines may increase that ADHD level. Then, of course, everybody, everywhere you go, has some type of digital device in front of them, and our attention span is much, much shorter than it used to be because of those things. So there are so many pieces that come into that puzzle. We certainly just need to be aware that there are things we can do to control it, to minimize it, and do our best with it, with what we have.
So this next headline really fascinates me and excites me. You want to go ahead and read that?
Yeah, so dark chocolate may be good for the eyes, study says. And that to me doesn't really get me all that excited because I don't like chocolate. But
Not even, are you a milk chocolate guy or just no chocolate at all?
I don't like chocolate at all. I'm one of those oddballs, but I know that you like chocolate, so this is a good thing.
It is, especially because dark chocolate is actually my favorite.
Is it?
Yeah.
Good. Well,
milk chocolate just tastes fake to me. Dark chocolate tastes natural.
Okay. Well, that's good. I'm glad that there are people out there who like it. I'm just not that guy. But we found there was actually an Italian study, according to this article, that said dark chocolate may improve eye health, and they found that it increased the retinal blood vessels and their function, which helped give them better vision. So kind of cool that a little bit of dark chocolate, something that most people enjoy or a lot of people enjoy, could be beneficial to your health. There are other things that dark chocolate through the years has been said to be good for, but there's another one.
It's my favorite headline so far today.
All right. Well, good. It's always good to have a good one that you like.
That's right. Our next headline, anti-inflammatory diet may reduce dementia risk by up to a third. Study. A recent study published in JAMA Open Network suggests that following an anti-inflammatory diet can reduce the risk of developing dementia by 31%, especially for individuals with cardiometabolic diseases such as heart disease, type 2 diabetes, and stroke. So this is really interesting, Troy. We have been learning a lot in recent years about the brain-gut connection. Could you explain maybe a little bit of your knowledge on like how this ties into what they're talking about here with this, these foods that we eat that cause all kinds of inflammation, and how that even affects our cognitive health?
Yeah, so we know that inflammation affects just about everything in our body. And if we can lower our inflammation, especially through our diet, we're going to be that much better off. Now, your point to the gut health, making sure that you've got good gut health and that you're checking on it, we know that the gut to brain connection is strong. And I don't think we ever in the medical world envisioned that the gut had that much of an impact on what our brain does, but it definitely does. And because of that, if you've got a poor gut health and you have a high inflammatory diet, we know that there is a greater risk of dementia. And this study, to me, probably the thing that stood out most in this article, 80,000 people they followed. So it wasn't just 100, wasn't just 50, it was 80,000 people. And with those 80,000 people, they followed them for 15 years. So some
It's a long
good,
study.
solid evidence, a long study, and should give us some ideas on what we need to do with our own diet, which they even suggest in this article, which I know that we have suggested before. Make sure that you have a diet that is full of berries, nuts, fatty fish, avocado, green tea, olive oil, vegetables, turmeric, mushrooms. Those are just some good examples of what to have. And then avoid all those refined carbs, fried foods, excess sugar, and alcohol. I mean, it's really not hard, but it is hard because it's all around us all the time.
And it's funny how so much of that just comes down to habits, right?
Yes,
Because, while I do like to indulge in some of those unhealthy foods from time to time, it's not really the norm. And for me personally, I notice a huge difference in how I feel when I'm eating those more natural, less processed foods that are better for me and trying to do that on a more consistent basis. And then when I do splurge and kind of eat those foods that are not so good for me and cause that inflammation, but I'm enjoying myself once in a while, right?
That's right.
But I do notice a marked difference in how I feel. And so I would encourage anyone out there who is in a habit of eating those foods just to give it a try to make some changes in your diet, and you see how much better you actually feel.
Yeah. No, I think that's a great word, and knowing that what we put in our body makes a big difference in our immediate health, but also our long-term health, as that study and article suggested. So our final headline for the month: trending eye color altering drops may carry risks, expert warns. So this is something that I'm not super aware of,
Me
but
either.
apparently there are drops that people are putting in their eyes to change the color of their eyes. Now, the American Academy of Ophthalmology said that with those drops, they are not actually they're not FDA approved or even FDA regulated, so you've got to be very careful. They've found that they've seen some severe eye damage, like certain infections. They've seen inflammation. They've seen vision changes, and they've seen increased eye pressure in those individuals who decide to put these drops in their eyes. Now, it's probably pretty cool to say, "Oh my gosh, my eyes just changed color," but there are always consequences to things that we put into our body that really aren't supposed to be there.
God made you the way that you are. Embrace it.
That's right. Thanks so much for joining us for this edition of Frontline Health by CenturionLabs.com. We hope you've enjoyed it. Evan, why don't you close us out?
Thank you so much for listening to this episode of the Frontline Health Podcast. For more information on health tips, recent health headlines, and our products, visit CenturionLabs.com. Be sure to like, share, and subscribe to this podcast and all our social media channels. Just stay up to date on all of these things and what's going on in the life of Centurion.